Hello, welcome to Dr. Ties, your medical expertise whenever you want. Please note that this is strictly for educational purposes and not intended for a formal diagnosis or treatment. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Today's topic is diabetes. Diabetes is one of the most common chronic conditions seen in both adults and children. It is characterized by insufficient insulin in the body, leading to high blood sugar or glucose levels. There are two main types of diabetes. Type 1 diabetes is a lifelong condition which is thought to be caused by autoimmune disease that prevents the pancreas from producing insulin. Type 2 diabetes is far more common than type 1 diabetes and usually occurs later in life. This is a condition where the body does not produce enough insulin. The other type of diabetes is called gestational diabetes, and this develops during pregnancy in some women. It usually goes away after giving birth. Pre-diabetes is when the sugar levels are above the normal range but not high enough to be called diabetes. This should not be taken lightly as it increases the risk of developing type 2 diabetes. This can be managed with lifestyle changes such as losing weight, regular exercise, and avoiding excess carbohydrates or sugars. It should be noted that it is very important to get an early diagnosis of diabetes to prevent long-term complications associated with untreated diabetes. The symptoms of type 1 and type 2 diabetes are similar, but type 1 diabetes can develop very quickly over days or weeks, whereas type 2 diabetes usually develops over years. The common symptoms of diabetes are increased thirst, urinary frequency, weight loss, feeling tired, frequent episodes of vaginal thrush, and blurred vision. Weight loss is common in type 1 diabetes rather than type 2. People with type 2 diabetes may not show any symptoms for years, and high sugar levels may be noticed during a routine blood test. Type 1 diabetes is not preventable through lifestyle changes, but type 2 diabetes can be prevented with healthy eating, losing excess weight and regular exercise. The risk of type 2 diabetes is higher with obesity or being overweight, high blood pressure, sedentary lifestyle, family history of type 2 diabetes, and certain medications such as long-term steroids. Gestational diabetes also increases the risk of developing type 2 diabetes. The treatment of type 1 diabetes is insulin, which needs to be taken for life. Mild type 2 diabetes can be managed with healthy lifestyle changes. People who are unable to manage their type 2 diabetes with lifestyle changes will require treatment with tablets or injections. Diabetes is a complex disease, and it requires multidisciplinary input from different healthcare professionals. People with diabetes should have regular follow-up with the usual doctor and diabetes nurse. It is strongly recommended to get regular eye screening, as diabetes can cause an eye disease called diabetic retinopathy. This condition occurs over time and can lead to sight loss if it is not treated. Diabetes can have an impact on the nerves in the feet, leading to loss of sensation. It can also reduce the blood supply to the feet. These issues can cause problems with normal feeling in the feet and difficulties with healing if injured. This can lead to the formation of diabetic ulcers and infections. People with diabetes should have their feet assessed every year. If there are symptoms that may suggest diabetes, it is strongly recommended to see a doctor in person for full assessment and early diagnosis. Early diagnosis will allow appropriate treatment to be initiated as soon as possible to prevent diabetes-related complications.